and this is for Shawn, actually. So given the current economic climate, will there be state budget cuts in Florida that will impact the delivery of services? Is there any pushback?
Yes, probably the thing we're most concerned about is the cuts that are being looked at in Florida in mental health and substance abuse programs. I mean, they're just, for some reason, they're the programs that are being targeted. It's no secret that many of our cases involve substance abuse issues, and we're concerned that the cuts they're looking at now within that system are going to bring more families into crisis and into our system. But within the child welfare system, things are looking pretty decent right now overall, and a big part of that is because of the progress we've been making. You know, you go to state legislators and say the things you want happening in your child welfare system as a whole are happening in Florida. We need to be able to continue that. It gives you a little bit of, you know, a pretty convincing argument that they should continue their investment.
What I would add to this also is the waiver that exists in Florida is a critical piece. It exists in Florida, it exists in Oregon, in Indiana, Ohio, and in a couple of counties in California, largely Los Angeles and Alameda. And the waiver is an agreement between the state and the federal government that says we each agree to hold consistent the level of dollars that we're putting into child welfare for this specified period of time of the waiver. And I think that that has made a huge difference in Florida, and especially in California. If you follow the news about the diminishing resources available in the government in California, but their child welfare investment has remained consistent because of that agreement. And that's one of the things about finance reform that we're pushing for, is reaching agreements where we commit to keeping consistent resources available to vulnerable children, families, and communities.